responsible. But it's a slippery slope. And the question of...
As you're all aware, I will just touch upon quickly how we formed this. In the last 10 years, this country has become one of the superpowers in the world, and all our eminent citizens who are doing great things in different parts of the world have started coming back to this country. Especially in the UK, where people like me trained, we adopted their lifestyle, their habits, not just at work but also at home. And after returning here, the 30th of December 2011. The first program in January was to celebrate the greatest British innovation in medicine, which is joint arthroplasty. And that's over, so we won't talk about it. Every program of the Indo-British Health Initiative has an aim. And the aim of this weekend's program, tomorrow and day after, is to focus on two main issues in gastrointestinal liver disease. Both these issues see the UK as the world leader. Firstly, the issue of prevention. A country like India, which is still a developing country, which has a lot of people who are destitute, finds it difficult to prevent disease and even more difficult for patients to afford treatment or cure. Huge amount of money. I am therefore honored that Professor Dr. Elwin Elias is here with us, who is probably one of the world's foremost experts in prevention rather than just cure.
As eloquently told you, it is also now possible to prevent liver here, something like this. But you need to know that most of the time, until the very end, patients are asymptomatic and abdomen getting bloated and looking quite unwell. But before that, there is a phase of 5, 10, sometimes 20 years, 25 with the complications of bleeding, fluid over. It come like this. It can be in this stage where it's just, it's just like when you have. So the important thing is to remember that there are a large number of causes, especially, let me just point where the infection tends to spread. 76.3 million people have liver involvement. We used to say we don't know the reason, it's hidden. Now we know that it is because a large number of them.
Good morning, everybody. It was so nice of the introduction and the welcome speech by Dr. Prithvi, and then followed by Dr. Chinese presentation. The most important thing that unit, don't mistake it. It is not like Arul and Dr. Dinesh. We have a transplant anesthetic and we can use the same blood again for the patient. And this is what is called as a rapid transfuser, which means a patient blood can be delivered, 1 liter of blood can be delivered within 30 seconds. So these are gadgets which will save the patient's life during the operation. With the liver, we remove all the extra structures that are there and then do the joining afterwards. And once the liver is removed from the recipient, that is the person who gets the liver, we have to remove the diseased liver first. So this is an empty space, as you can see, and these are the blood vessels which is the big inferior vena cava, this is the artery, and this is what we call as the portal vein. So all these structures will be joined, rejoined again, and once the joint is done, see, the new liver looks so good. And this patient will have this is a very good quality liver.
You, our honored guest, Professor Dr. Elwin Elias from the United Kingdom. The huge importance of having him here is, as I said before to some of you, is that he set up the first liver unit in Birmingham at the Queen Elizabeth Hospital, and he started it off, as you are aware, at very young. And I think the hepatologist there was also a rheumatologist. But anyway, so he had his own laboratory, and as you've heard before, it was a huge struggle because he was not actually given a huge amount of funding by the government, but he has can actually walk away without risk on his own. He has also discovered a new disease that is peculiar to our country, and I think that the focus of this 2 days, which is prevention and innovation, we could ask for no one better than Professor Dr. Elvin Elias, who symbolizes these two words, prevention.
Discussion in the UK at the moment, because the doctors are very, very strongly in favour of the idea that raising the price of alcohol is a major contributor to preventing the disease. And the doctors know, I think, and I say no because if you look at all the evidence alcohol is, the more people will drink, and the more people will drink, the more liver disease you see. And that's been shown over, even over a century. You can plot the cost of alcohol related to the prevalence of alcoholic liver disease. Now, the alcohol industry is very, very powerful, and it pays people in the parliament to lobby the parliamentarians, and dare I say it, to influence them, so that they're very, very reluctant, in fact, to raise the price of alcohol so that the sales actually go down. So a lot of the prevention is done at that level, I think, at a political level. Now, the other important thing, and I'm sure this is a key thing that the doctors here will be taking on board, I think one of the best things we did in the Birmingham Liver Unit was to have a person whose job it was full-time was to deal with the alcoholic patients, with the out and he drank and he came back drunk kind of thing, you see. So until he had worked through his anger, and until the psychiatric social worker who was working with us said, look, this chap now, and I've spoken to his wife, and I've spoken to his children, and I've spoken to the people who work with him, and there's a real understanding now between them all of how their relationship will be better if he has a transplant. It was only then that we would put him on the list in order that he could have a transplant. And the outcome was very, very good. Best was like the...
Other thing, Sujata, is for you to notice that today we have enough methods to prevent progression of disease. So people need to be aware that even as they get unwell, they should consult a doctor and ensure that the disease progresses.
Well, more than 90% of patients these days would survive the first year, and more than 90%, the subsequent survival depends on whether you've been able to cure the original disease. So if the original disease was alcohol or hepatitis C or other things that you may not have cured, then obviously that's going to affect survival. But most liver diseases, you have to be cured by doing a transplant these days. So if you cure the liver disease that killed the first liver, then your patient should have a normal life expectancy.